Well, Happy New Year. It is now January 1st, 2021, and I am off from work today. Well, really, I'm never truly off from work. Certainly, I have plenty of things to do. And as I was catching up today, I decided to make this video about Botox for migraines. This is a treatment that I utilize commonly for chronic migraine, and I'm hoping to provide all of you with at least some insightful information today. But before I do that, I wanted to briefly make a mention of this book by Catherine Foxhall, Migraine: A History. Recently, the American Headache Society had a conference, and one of the workshop sessions, we talk about good books that are out there or good articles for us to read. And Dr. Alan Purdy, who is a very well-known physician in the American Headache Society, even though he's Canadian, had brought up this book, Migraine: A History. I will admit I have not read this book. I intend on reading it. I'm bringing it up because apparently it does provide some insightful information about migraines, things that you all may be interested in. Apparently, the book is free from Johns Hopkins Press. And like always, at the end of this video, I will provide the link for that in the description below here. Okay, so later on, if you want to check this out, it is free. So what's the best kind of book? A free book. So it's not going to hurt anybody to check this out. Now, I would really like to address a few myths and misconceptions about Botox. First, this is not a new idea. I mention this because sometimes whenever I discuss Botox as a treatment for chronic migraine with my patients, I receive a very unusual look as because the first thing people start wondering is, well, isn't this something for cosmetics? And you want to give it to me for my migraines? For what it's worth, Botox has been FDA approved for the treatment of chronic migraine since the year 2010. I personally have been injecting Botox since the year 2005, whenever I first entered my training as a neurologist. At that time, it was not FDA approved. I've lost count of how many injections I've performed in my career, probably thousands at this point. The only thing I would say is this. As of 2010, we have something called the preempt protocol. I'll explain what that means a little bit later. Whenever I was initially trained with Botox injection, I was trained a little bit differently than the preempt protocol. So over time, I did have to adopt the preempt protocol and change my ways a little bit. You will not be injected with a live bacteria if you have Botox. So Clostridium botulinum is a bacteria that does produce a very dangerous neurotoxin. If you do become infected with Clostridium botulinum, yes, certainly that could be very dangerous. What Botox is a purified protein. Well, it's a neurotoxin made by the Clostridium botulinum that is purified. You will not actually be injected with the bacteria. The next thing to mention is it is not for your lips. As I've already mentioned, sometimes people are very confused because as soon as I say Botox, they start thinking cosmetics. Botox does weaken muscles, and because it does weaken muscles, if you have some lines and wrinkles in your forehead or around your brow, it will flatten those wrinkles out. You may notice, if you do have Botox for your chronic migraines, you may notice a little bit of a cosmetic effect. But in reality, the injection areas around the brow are a little bit different for cosmetics than they are for chronic migraine. Same with the forehead. So just to back up here for a moment, if we were going to use Botox for cosmetics, it is strictly for wrinkles and lines. It's not going to do anything for your lips. If I was a jerk and I actually injected Botox into your lips, you wouldn't be able to talk correctly, okay? I would weaken your lips. That would be a very bad idea. Now, Allergan, the company that does manufacture Botox, they do manufacture some fillers, dermal fillers. That's not my area of expertise. I've never injected dermal fillers in my entire career, so that might be why people are confused when I mention Botox, or why they might believe Botox is to get nice full fat lips. It is not, okay? Those are different products altogether. Something else I do have to mention is we do not purposefully throw away your Botox. Now, the reason I mention that is this. The FDA has approved 155 units of Botox for the treatment of chronic migraine. So, Botox, if we order Botox through your central pharmacy, here is how Botox comes to our clinic. It is available in 50-unit vials, which traditionally those are the vials used for cosmetics, 100-unit vials, or 200-unit vials. So for us in neurology, if we're going to be treating you for chronic migraine, we would either A, order one 200-unit vial, or B, two of the 100-unit vials, so that we have available for usage 155 units. What does that mean? That means we have to throw away 45 units. Now wait a minute, didn't I just say we don't throw things away? Let me clarify this. You may notice that when I inject you with Botox, you may see 4 little syringes, and you may notice that the last syringe still contains some Botox, and you may watch myself or one of the office staff throw it into the sharps container and think to yourself, oh my God, he threw away my Botox. Well, we do have to quote unquote waste that 45 units. It is required that we do that. There are codes that we can submit to your insurance company when we make a claim to your insurance company that indicate that we wasted 45 units of Botox. And we do account for every unit. Whenever I do document your injections, I document how many units I injected into each muscle. Unfortunately, this is just the way it has to be, okay? As long as Allergan is going to manufacture 100-unit vials and 200-unit vials, we're always going to have to throw away 45 units. Now, let's do some quick math here. If I were to take Botox patients and line them all up throughout the day, if you do some quick math in your head, what you would figure out is this. If I had 4 patients come into the clinic and I saved the 45 units for each of those 4 patients, the 5th one could be free, right? Is that immoral? Is that unethical for me to do that? I might be able to make an argument, no, but here is the problem. Your insurance does consider it fraud. Unfortunately, it's insurance fraud. What your insurance will argue is the following. The insurance will argue that they paid for 200 units of Botox for you. They did not pay the Botox for a different patient. So if I take the 45 units left over from your Botox session and inject it into another patient, it is considered insurance fraud. So as stupid as this sounds, yes, I do have to throw away your 45 units of Botox. Now, if you were to come to my office and have 4 sessions of Botox, could I save those 45 units each and every time and then your 5th one would be free? No. Unfortunately, the purified protein, it comes on dry ice. It has to remain refrigerated. It has to be reconstituted with saline while it is still cold, and it has to be injected immediately thereafter. And it will not keep for months, okay? Now, there are some individuals out there that do make an argument that you can freeze Botox after it is reconstituted, maybe save it for a couple of weeks and it still might be active. But in reality, after months, no, it's not going to be active anymore. So again, I know I've really beat this like a dead horse. We're going to have to throw away 45 units. However, your insurance will allow this. They will not frown upon this, even though it seems like a waste of money, and sometimes it is. This is just the way it has to be. The last thing to mention is these injections do not last forever. Okay, now the reason I mention that is this. If you were to, say, get a droopy eyelid after the Botox, it's not going to last forever. The Botox stays in your system for about 3 to 4 months. So if you were to, say, get a droopy eyelid from the Botox, within 3 to 4 months, you're going to see return of muscle function in your eyelid. On the same note, if you receive Botox and do not have any side effects or any adverse events, and you find it to be helpful for your migraines, you're going to see return of your migraines or increase of your migraine frequency within 3 to 4 months as well, which is why we do the injections every 3 months. So at the end of the day, the positive things with Botox and the negative things do not last forever. I would even argue with many of you that many of my patients report that they know when they're due for the Botox. It's probably about a week before their injections are due. They start to notice more migraines. So the medication does wear off. So this Botox seems like a very good treatment for chronic migraine. However, all good things have their challenges. Pre-authorization is an immense challenge. You will not believe how many hours of time my staff is bogged down in the office making phone calls and trying to get this medication pre-authorized with your insurance. It is a nightmare. In fact, there are some headache clinics that I am aware of that will actually charge their patients $50 for the privilege of their office staff pre-authorizing the medication. I don't think that would go over very well in my clinic. I imagine that many of you that come to my office, if I told you that we need to charge you $50 of your own money to get Botox pre-authorized, many of you would say no. However, I suppose some people in this world that are more important than I am, or maybe have a better reputation in the headache world than myself, do this. Also, there is a challenge with the copays and the co-insurance. Many patients complain that it may cost about $150 of a copay every time they come in and have a Botox injection. Now, if you don't mind, I'm going to break this down for you and propose to you that you're actually receiving quite a deal. $200 units of Botox, which is what we have to obtain in order to perform these injections. This is going to cost anywhere between $1,000 to $1,200 roughly. Yes, you are, every 3 months you are being injected with at least $1,000 worth of medication. And you are being asked to provide $150 towards that. And that does not include the fee that we charge your insurance to inject it. What that comes down to is $50 a month, or roughly $1.67 a day. So let me ask all of you a question. Do any of you out there have habits that you spend at least $1.67 on every day? How many of you out there buy a coffee every single day? You go to a place such as Starbucks and buy yourself a coffee, and you're willingly handing over much more than $1.67 a day. How many of you people smoke cigarettes? How much money do you spend per day smoking cigarettes? And my personal favorite, I have nothing against tattoos. I don't have any myself, for what that's worth. I don't have a problem with tattoos. I have no issue with my patients going out and having tattoos. But I will say this, it never ceases to amaze me how much money patients will willingly, cash in their hand over to receive a tattoo. But yet they will gripe about having to pay $1.67 per day to have a treatment that is very effective to reduce their migraines. So, yeah, some people genuinely cannot afford these fees. I do understand that. But for other individuals, please consider making some lifestyle modifications. You know, I am not even asking you to quit smoking. Just smoke a few less cigarettes per day, and you can afford this medication. I'm not asking you to give up having a tattoo. I'm just saying maybe that one time you might want to put that money aside and save it for your Botox. And of course, there are insurance barriers, and I will move on to that in just a moment here. Anymore, every single day of my career, the following statement comes out of my mouth. There is what I would like to do for you, and there is what your insurance will allow me to do for you. Another way to look at it is this way. A colleague of mine once proposed it this way. Think of us as a waiter. We will tell you what's on the menu, and you have to choose what is on the menu. And that's really all that is available to you. So what I have here before you now, some of you have seen this table before in other little talks that I have given. These are the levels of evidence that come from the guidelines, the actual official guidelines from the American Academy of Neurology, which is pretty much in agreement with the American Headache Society, is to medications that are FDA approved for the treatment of migraine. And again, going back, these are the levels of evidence behind these medications. Okay, now I'm going to add in those two, the CGRP antagonist and Botox. First of all, let's just make something very clear. Botox is only FDA approved for chronic migraine, not just for episodic migraine. So in other words, you have to be a patient that has at least 15 headache days a month. And of those 15 days a month, at least 8 of them have to be migraine. So Botox is not a go-to treatment for every single patient that walks into my clinic who has a migraine. It is a very effective treatment for chronic migraine, and it is the only FDA-approved treatment for chronic migraine per se. The CGRP antagonists have been studied in chronic migraine. They are approved for migraine no matter what type of migraine you have. But when it comes to chronic migraine, specifically, this is what Botox is FDA approved for. So as stupid as this may sound, okay, if we go over here, let's see if I can pull a little thing, okay, level A and B, this is, okay, these medications that have level A and B medical evidence for the efficacy of migraine, your insurance company knows that probably admittedly better than I do, okay? And they will force us to try a medication from each of these categories before we propose Botox. Now, let me explain why this can be a little bit of a problem, okay? So let's say you come to my clinic as a new patient and you say, well, I've already tried amitriptyline, an antidepressant. I've already tried propranolol, a beta blocker. But I've also tried venlafaxine, and I've also tried atenolol. And I say, okay, it sounds like you've tried 4 medications for your migraines. It didn't really work out very well. Now you have chronic migraine. Let's talk about Botox. Well, when I send in the pre-authorization for your Botox to your insurance, the insurance company is going to say, well, that's nice that the patient has tried 4 medications for their migraines, but you know they never tried an anti-epileptic, so they will deny the Botox authorization until I try at least one of these anti-epileptics. Now, I don't think that is a very efficient way to do this, but unfortunately, that is how your insurance looks at it. As well, if you have chronic migraine, these medications, while they do have very good medical evidence behind them that prove that they are effective for the treatment of migraine, these two really, are the only ones that have any type of medical evidence that show that they are good for chronic migraine. Actually, well, that's not really quite true. I mean, we can go through some things with topiramate and other things, that's besides the point. But for the most part, this is a drug for chronic migraine, okay? If you have chronic migraine, theoretically speaking, we should go right to this. Your insurance doesn't always see it that way. So what I'm saying to you is this. What this boils down to is the following. If you come to my office, you may have already tried numerous medications for migraine. Until you have tried one medication from each of these categories, your insurance will not allow me to approve the Botox. So there can be a little bit of a delay. And for what it's worth too, some patients are very complicated. Okay, some of you out there may have Botox done and do have some positive effects from it, but still have a good number of migraines. You may need to be on combination therapies. So overall, we have to fight with your insurance often. It's the downside of the job, but please be patient with us and we'll work on it. Well, how does Botox work? Why does this stuff even work at all for chronic migraine? This is a nice diagram. This diagram comes up in many talks about Botox, so please give me a moment to go through this and explain it to you. First of all, there's different types of Botox. Botulinum toxin A is, Botox is a type of botulinum toxin A, okay? There are some other products out there that are botulinum toxin A. Xeomin is a botulinum toxin A product. There's also botulinum toxin B available commercially. Things such as Myoblock is a product that is botulinum toxin B. So how do these toxins work exactly? What exactly do they do? So if you look at a nerve, right? So here's a nerve, and over here to the left is a nerve, and over here to the right is a muscle receptor. So what happens is these nerves fire little vesicles of acetylcholine over to the muscle, and the acetylcholine tells the muscle to work. Okay. Think of it as a spark plug, okay? You know, there's a little gap in your spark plug, and little sparks fire across to get your engine going. Same type of concept, only instead of a spark, we're firing little vesicles, little bubbles filled with acetylcholine, okay? If you were to have an autoimmune disease that affected these little receptors on the muscles, such as, say, myasthenia gravis, no matter how well your nerves were functioning, your muscles wouldn't work out very well. You'd have weakness, double vision, respiratory issues, those types of things that you can have with myasthenia gravis. What happens at a microscopic level is this. In your nerve over here, right, the terminal of your nerve, you have all these little vesicles, these little bubbles filled with acetylcholine. Think of it as a cruise ship carrying passengers, right? When they get here to the cell membrane, they're going to dock. Okay, they're going to dock like a boat docks, and these little passengers are going to get off the boat and go across this little nerve gap and link up with a muscle receptor. Along the end of the nerve cell here are these little docking proteins. Okay, so one of those docking proteins is called SNAP25. So what botulinum toxin A does is it shuts down SNAP25 so that when the acetylcholine hits this nerve terminal, there's no way for passengers to get off the boat, so to speak, okay? And botulinum toxin B affects synaptobrevin in the same manner. Now, I do want to make a comment here because I did mention that there are other products available, Xeomin, MyoBlock, and Dysport, okay? Even though those are commercially available forms of botulinum toxin, they have not been studied for chronic migraine, okay? There are no double-blind and randomized placebo-controlled trials that show that those medications are effective for chronic migraine. So therefore, those products do not have an FDA indication for the treatment of chronic migraine. They're used in other disorders, such as movement disorders, such as dystonias. Okay, that's a different story altogether. There are some doctors out there that do use these products for chronic migraine. Okay, what I would say about MyoBlock, it's a little bit different. It is already in a liquid solution. It does not need to be reconstituted. It is much cheaper than botulinum toxin A or Botox. So there are some doctors out there that do go ahead and inject MyoBlock for the treatment of chronic migraine for patients who do have to pay cash because it is much cheaper. However, they try to explain to their patients, one, we are giving you an off FDA labeled treatment, and I will say the pH of that solution is much different. It tends to burn much more than Botox. Would I give botulinum toxin B or MyoBlock for chronic migraine? I don't think I'd feel comfortable doing that. I think I would be opening myself up to medical legal issues. Okay, so unfortunately, we have to stick with Botox if we're going to be treating chronic migraine. So, where's the Botox injected? How many injections are there? And does it hurt? These are very common questions. I provide many of you with the, there's a nice little handout by the American Headache Society. They have these little handouts called Headache Toolbox, and I'll provide a link below in the description for their little handout that has this nice little picture here, okay, that shows you all these little yellow dots are injection sites, okay? There's 31 total, and you may not see it very well. There are some here along your trapezius muscle, okay? This comes from the PREEMPT protocol. I mentioned PREEMPT earlier. So what exactly does that mean? The two trials that were clinical trials that were performed were called PREEMPT 1 and PREEMPT 2. And those trials really are what launched Botox or botulinum toxin A to have its FDA approval for the treatment of chronic migraine. As I was saying earlier, in my career, we used to do things a little bit differently. I would do maybe a few more injections along the forehead, but smaller number of units. Sometimes in the neck area, we would do what we call chase the pain. Okay, well, that's fallen out of favor too over time. So one of my colleagues, who's a very gifted headache doctor, proposed to me that, hey, look, you know, the men and the women who sat down and came up with this PREEMPT protocol, they really took their time on figuring out these injection sites. They are the experts. Maybe we should just go with what they say. And so I've adopted that paradigm over time too. Now, I'm going to make a comment about torticollis here in a moment, because some of you who are my patients might be watching this thinking, well, it doesn't seem right. I get more than this when you inject me. I'll explain that in a moment. Now the question, does it hurt? Well, the needles that we inject Botox with, unfortunately I don't have any available with me today to show you. They're 30 gauge needles, and they're very, very thin. They're very tiny. So they're, this big, versus some of you who have had epidurals, or even a nerve block, occipital nerve block. Okay, I mean, these things are very, very thin. They're very tiny. They're a ½ inch long, and they're extremely thin. So unfortunately, any type of discomfort that you may have from the Botox is going to be from the actual Botox solution after it is reconstituted. It may burn a little bit. It may sting. That is not going to come from the needle. It's going to come from the actual solution. Okay, so what I tell many patients is this. If I place that little tiny 30 gauge needle in your skin, that's probably not going to bother you very much. When I inject the Botox under your skin or into the muscles, that is where you may have some discomfort and some burning. Most patients do very well with this. They tolerate it very well. I usually tell my patients the first time, if it burns afterwards, apply some ice to the skin. In the old days, when I really first got started with this, as I was saying, in the military, where we could do virtually whatever we pleased with Botox, there were some pain providers that used it quite frequently for back pain. Even we in neurology did that. One of my attendings was involved in a big study with using Botox for back pain. We could get away with it in the military. We can't do that in the civilian world, unfortunately. But one of the pain doctors proposed back then, well, you can mix this stuff with some local anesthetics, things such as lidocaine and marcaine, and it won't burn as bad. I think what I found out over the years is it burns more if I do that, but it doesn't burn all day. The skin may feel a little bit numb. So pick your battles there, okay? Also, a few years ago, there was just one case report out where somebody did have Botox reconstituted in lidocaine and they died. However, they had an open skull surgery. So the theory is that with open skull surgery, there was a risk that maybe there was direct contact with the brain with lidocaine. Who knows? But because there's one case report, most doctors don't, or we've come to the agreement, we're just not going to mix lidocaine with Botox, okay? Some of the side effects, again, it can weaken muscles. If you open the package insert, it will tell you that, it can cause issues with breathing and spread to different sites. So here's what I'd say about that, because package inserts sound very scary, okay? The benefit of FDA-approved medications are the following. Any drug that has been approved by the FDA has had to have been tested for safety, and we have to include safety information in our package inserts. Sometimes these things scare people quite significantly. So here's what I would say. I believe that, remember, we use Botox for all different types of medical conditions, okay? Outside of chronic migraine. There are some people that do receive injections directly into their vocal cords, okay? I imagine those people, for obvious reasons, may have some respiratory or swallowing difficulties, or maybe at least a little bit of a higher risk. I've never had a swallowing difficulty or somebody quit breathing for chronic migraine, okay? I'm gonna knock on wood. Hasn't happened to me yet, okay? Of course, it's in the package insert that it can happen. I would say some people get a little achy afterwards. There is a transient flu-like reaction. Most doctors do not commonly talk about that, but I would say I have seen that happen in a few patients. Sometimes it can cause some weakness of the neck. So there are some people, I'd say, they call up the clinic the first couple of days afterwards. They're very, very angry because their neck hurts. They usually get over that within the first week, and then things go quote unquote back to normal, and then they're usually pretty happy with the results with their migraines. Now, I mentioned earlier cervical torticollis dystonia. We do use Botox for this condition as well. So basically, what is dystonia? What is torticollis? Those are fancy words for people that have these neck conditions. These are kind of extreme, okay? So in this person's case here, this muscle here, this sternocleidomastoid muscle, as you can see, right? These muscles, they come from behind the ear, the mastoid, to the sternum, the sternocleidomastoid. When these things tighten up, they can twist the head into all different types of directions. And then what happens are muscles around the side or the back of the head sometimes will compensate for that spasm, and they'll lock up as well. And we have all different types of colluses: torticollis, lateral collus, retrocollis, anterocollis, okay? These are extreme pictures, okay? Have I seen people that look like this woman here? Yes. But I would make a argument with a number of you that many of you patients with chronic migraine have just a little bit of torticollis, any of you that are my patients, you know this. You know that when I examine you, I will look at these areas and elicit pain and discomfort in those areas. Now, why is it that some of you, if you see me as a patient, why is it that some of you receive the injection like the preempt protocol that I showed on the previous slide and receive some additional injections into these neck muscles? Well, as I explained earlier, we have lots of Botox, and unfortunately your insurance company makes us throw it away, so we might as well use it all. The other thing too is I'm going to share a little secret with some of you. Remember earlier when I said that, gee, we can't just jump right to Botox as a treatment. We have to try everything. Sometimes if you do legitimately have some torticollis or lateral collus, we can justify going right to Botox. Now, am I pulling a trick on your insurance company? No, I'm not. As I just said, many of you that we do this, you do legitimately have this condition, maybe not to this extreme, but you still do have it, okay? And for what it's worth, your insurance does not reimburse as much money for injecting for torticollis as it does for chronic migraine. So as odd as this may sound, if we have the Botox approved for your torticollis and we inject your torticollis sites and your chronic migraine sites, we're only going to get paid for the torticollis sites. So at the end of the day, you benefit. We really didn't pull any tricks on anybody. So in conclusion, I do believe that Botox is a very good treatment for chronic migraine. As you can imagine, in my clinic, I see many patients with chronic migraine. I think we can all agree that if you have migraine on occasion, it's not a big deal. Okay, if you have migraine once or twice a month, that's something your primary care doctor can handle. When you have frequent migraines, then you have to go see a neurologist or a headache specialist. And when you get to chronic migraine, your life is miserable. This is a very good treatment. Unfortunately, it does require us to do a number of injections. That is true. But I do think it is a very good treatment. I've seen very good and very dramatic results for my patients with this treatment. I've provided you with some basic information here today. If you have any other questions, of course, please do not hesitate to ask. Again, any type of information that I referenced throughout this talk, the links will be provided below in the description. Thank you and have a nice day. Have a nice new year.